So first of all, lose the boyfriend. You'll lose 300 pounds just like this. Hello, everyone. Welcome to my favorite show, DocTalk. I'm here with Dr. Janet Choi, Chief Medical Officer at Progyny. I'm Lissa Kline. We're so excited today to talk about PCOS.
Yes, not PCOS, PCOS.
PCOS. September is PCOS Awareness Month. PCOS is polycystic ovarian syndrome. And in this episode of DocTalk, we're going to dive into real questions, concerns, and stories people are sharing on Reddit. And I see a lot of this stuff on Reddit, but I see it all over social media. I think it's really misunderstood and really confusing for people.
And there's also a lot of incorrect information floating around in social media. So you have to read the disclaimer here.
Yes. So from confusing symptoms to treatment frustrations to the emotional side of living with PCOS, these conversations are happening every day, a lot in the Progyny offices, but also online, clearly, and often without clear answers. And just a reminder, our legal team is telling me to say this. This show does not replace the advice of your doctor. She's a doctor, but she's not your doctor. And so see a doctor. We're just sort of talking and answering these things online, but this is not constituting medical advice.
Correct. Although we are trying to give more evidence-based.
That's true. Yes.
information than what you find on the on the interweb randomly.
So the information shared here is for education and awareness, as Dr. Choi said, and we encourage anyone with questions about PCOS or really any other health state to speak to their healthcare provider. So I'm going to read some of the posts on Reddit, and then we're going to discuss. This is going to be fun.
Oh, yeah.
I've had PCOS for probably a decade now. I'm 30. My periods were always all over the place, so irregular. Sometimes I'd go 8 months without one. I'm currently at my heaviest weight and probably the most unhealthy I've ever been, and I have IR, and we didn't know what she meant by
insulin
IR.
resistance.
Oh, insulin resistance, yes. But somehow for the last 8 months, I've gotten my period every 28 to 30 days. How is this even possible? I'm not complaining, but it just seems so odd. So let's unpack. She's had PCOS for more than a decade, probably a little longer, but probably started having symptoms for more than a decade.
Yep.
Her periods are all over the place. She'd go 8 months without one. Why do people with PCOS often have what's like amenorrhea or either an absence of periods or really irregular periods?
So what happens is usually young people who have PCOS, polycystic ovarian syndrome, they have enough eggs in their ovaries to create estrogen. However, those eggs are not getting the right regular monthly wake-up call from the brain, the pituitary, and the hypothalamic pituitary axis control center to get one of those eggs to wake up, mature, and then ovulate, and then cause the body to secrete a hormone called progesterone in a regular fashion, which is what happens when people have very regular, predictable cycles, for the most part.
Yeah.
And so people who have PCOS, because they're not getting the right signaling, they have either absent periods or very unpredictable, and it's really annoying, because sometimes the periods may not show up for like 6 to 8 months, and all of a sudden you just have a gusher of a period, and then you might have spotting, and then it just goes back to months and months on end.
Yeah. She talks about weight being a concern and insulin resistance. I'm glad we figured that out. So weight, especially like belly fat, is something common with PCOS. And insulin resistance is also related. Can you talk a little bit about weight and insulin resistance?
Yeah, so again, a fair percentage, and I can't recall the prevalence right off the top of my head, but a fair percentage of people who have polycystic ovarian syndrome also have a higher than healthy body mass index, usually overweight or obese range. And what's very useful is for those individuals who have that, both for heart health and other reasons, in addition to trying to help sort of in a more natural fashion regularize their cycles. Sometimes just even by losing a few pounds, they'll find that their cycles become more regular, not irregular. Now, what's interesting about this person is this person notes that for some reason, even though their cycles have become more regular, they've put on more weight and are insulin resistant.
Yeah.
So I wonder, the question I have here is were they actually prescribed a birth control pill, and that's why their cycles are actually more regular, because the pill is imposing its own schedule? Or, the other thing also just to bear in mind is although most people with regular cycles, 28, 30 days, are ovulating on their own, some people are not. And sometimes they can be still anovulatory, even with regular cycles.
With the period.
So one really important message here to take away from this, and this was a great commentary and question for us to start off with, is if the person has had a history of very erratic periods and they're not on any kind of hormonal contraception like a progesterone IUD or birth control pill, then one of the things is don't be shy about bringing this up with your gynecologist, because sometimes some testing might be in order also.
Yep, agreed.
Yeah.
Okay, next one.
Yeah.
Highlight or headline.
Ooh, relationship advice too.
Yeah, we're going to do it.
Oh, and Lissa Kline's an LCSW as well.
I'm your therapist. She's not your doctor. I'm not your therapist, but we're pretending like we are. So the headline here is, my boyfriend said PCOS is an excuse not to lose weight. Okay. I've been told I'm going to be bleeped. She says, I'm so annoyed. I was diagnosed with PCOS 8 years ago. I work out and eat really healthy, mostly sugar and gluten-free. And losing weight is so difficult. I started Ozempic 8 months ago, and it's the first thing that has actually helped me lose weight, and I feel amazing. I loved it. Yes. I stopped it, but now my boyfriend said PCOS is just an excuse not to lose weight, and it drove me crazy. I worked for years to lose weight, and it was a struggle. We are the same height. I weigh 170 pounds now, and he weighs 300 pounds. Oh my gosh, this is getting worse. I work hard and do what I can, and he doesn't do anything. It was just so hurtful for him to judge when I'm actively trying to take care of myself. Okay, so first of all, lose the boyfriend. You'll lose 300 pounds just like this. So
You'll feel so much
you'll
lighter.
feel so much better.
And by the way, kudos to everything you've been doing to
Yes.
keep yourself healthy. I think you get props for that.
Yeah, agreed. So I really like that she pointed out she works out. That's good. It's often not enough to lose weight.
Yep.
For PCOS, but even outside of that, it's often not enough to lose weight. She eats really healthy,
Yep.
sugar and gluten-free,
That's great.
which are really good. And both movement, so like being active and a nutritious diet are really good things to do if you have PCOS,
Absolutely.
right? I'm curious what you think about her going on Ozempic. So it's something that we've heard a lot about
Right.
as it relates to insulin resistance and PCOS, and seems like it worked for her for a short time. What are your thoughts?
So I think that there are definitely different methods to manage weight loss for those who are in the obesity range or in the overweight range and
Yeah.
are insulin resistant, pre-diabetic, and have other health risks and
Yeah.
things. Ozempic, or that category of drug, GLP-1s, GLPs, and things like that, are definitely, there are appropriate use cases, and this sounds like one of them, where a person has tried other methods of losing weight
Right.
beyond just exercise, diet. Maybe they tried metformin and some other older category drugs, and so those didn't necessarily work. In those cases, a GLP-1, especially if you're not trying to actively get pregnant in the moment, can actually be a very useful tool in conjunction with, and again, props to this person, like not just sort of relying on this injection to get them through the weight loss process, but making sure that they've actually changed their lifestyle.
Yeah.
Right?
Yeah, and Ozempic is almost always, I think, prescribed by physicians, so sounds like they're also under the care of a doctor, which is really good. So they're doing all the right things. I would tell the boyfriend, if you're still with the boyfriend, that
Take a hike.
Yeah, take a hike.
Could be beneficial.
Right, but PCOS does make it more challenging to lose weight. It's not an excuse.
Right.
And frankly, commenting on someone's weight is just unkind.
No, and totally uncool.
Yeah, totally
Right?
uncool.
Especially if
Don't
it's
be
someone who
uncool.
supposedly like cares for you. So
Yeah.
agree.
Agreed. Okay. Next one, mental health is a game changer when it comes to managing endocrine diseases. Agreed. Okay, she says, or they say, hey everyone, I just wanted to share something that's really clicked for me recently. Taking care of your mental health isn't just good for your mood. It can make a big difference in managing endocrine disorders too. I've been dealing with PCOS, thyroid issues, insulin resistance, and while meds and lifestyle changes matter, I notice that when my stress is high or I'm emotionally drained, my symptoms get worse. Stress messes with hormones like cortisol, insulin, thyroid hormones, and more. It's all connected. Once I started prioritizing mental wellness, things like therapy, meditation, better sleep, and even just setting boundaries, I felt better. I love this.
Yes.
It's another
Public service announcement also
Yeah.
for the PCOS population, for everybody really.
Yeah, it's really good insight, I think, to make lifestyle modifications and observe the differences. So understand, like, when my stress was high, my symptoms got worse, so let me work on my stress.
Yeah.
I think that's really clever, and not everyone makes those connections, so I love that.
And I think if you have a smartphone, a lot of them now have these apps built in where you can actually track right, some of your symptoms day by day and sort of try to correlate. So this person actually is doing great things to take care of themselves.
Yeah.
And super important, because actually people who have PCOS do actually suffer higher rates of things like depression and anxiety. So
yeah.
really making sure that you have some support for your mental health needs throughout your life is super important.
Yeah. I like that. Also, they were talking about other hormones that I think stress increases other hormones, and that can impact symptoms. So is it true that cortisol can mess with PCOS symptoms, or is that maybe not connected?
Yeah. The adrenal gland can get involved. There are other hormones from the adrenal gland, also DHEAS, that we also assess can be slightly elevated with people with PCOS. I wouldn't necessarily blame cortisol per se, but it's true that people who have chronic stress, especially if it's a lot of undue stress, that can sometimes, for someone who even has regular cycles, can sometimes mess with their cycles as well, temporarily. Yeah.
So kudos to you for working on decreasing stress.
And sharing this also with the community.
Yeah, and managing your symptoms. I love it. Okay, ready? Next one?
Yes.
So headline here, any suggestions? Endocrinologist and GYN fighting over whether I truly have PCOS. So this one's quite long, and so I might not read all of it, but I'm going to give you the gist. Okay. This is a 33-year-old female, self-identified. She says about 5 years ago, I gained over 50 pounds in 5 months, which I chalked up to switching to a desk job, so being more or less active. Around the same time, I developed rosacea, shooting breast pain, and I started seeing increased hair along my chin, neck. So far, these are the increased hair is a PCOS symptom, as well as weight gain. I started going to an endocrinologist the following year. Good for you for accessing healthcare. Originally, she told me she didn't think I had PCOS because my periods were normal and my testosterone levels were normal. However, I did have high cortisol and a very difficult time losing weight. So then 2 months ago, she goes to see her GYN. She was having some pain that was on and off for a couple of months, and the GYN told her the most recent blood work had slightly raised testosterone, but because my periods were normal, she still didn't think I had PCOS. She had an ultrasound, and she didn't see anything concerning. She went back to the endocrinologist, who now thinks I may have PCOS, and after years, it may just be starting to show up in my bloods now. I'm waiting to see if the abdominal pain stops and this cycle. Oh, and I haven't had any recent breast pain or rosacea breakouts. I still have some chin neck hairs coming in and still having trouble losing weight. Disappointment, she was told she also has insulin resistance. So it sounds like two doctors have different, maybe slightly different opinions. I'm curious, how do you diagnose a person with PCOS? Like, what is the typical diagnosis?
Well, Dr. Kline, you know this as well as I do now,
this.
having worked in a fertility clinic and running one. So there are different ways to define PCOS, but the most commonly used one is you have to have two of these three major criteria. So number one is absent or irregular periods. Number two is either clinical evidence, so like hair on your chin, acne, hair on your back, or on the space between your belly button and pubic bone, sort of like hyperandrogenism manifestations, and or on blood test, an elevated total testosterone, right? So some evidence, whether it's through testing or through just bodily evidence of high androgen activity. So that's criteria number two. Number three is polycystic looking ovaries on ultrasound. So what that means is you could have the last two and still have regular periods, and once you rule out other causes for some of these symptoms, you could end up having polycystic ovarian syndrome even if you have regular periods. And remember what I said a few minutes ago, some people can still have regular periods and still not be ovulating, right? The other thing is they were told that, and this is a common refrain that I've heard from patients before. They're like, well, because my periods were regular, my doctor said I didn't have PCOS. The other thing is with the ultrasound, it depends on how the acuity of the ultrasound machine, because some doctors' offices have, for a variety of different reasons, older versions of an ultrasound machine, and if they're not doing ultrasounds every single day like a lot of fertility doctors are doing, reproductive endocrinologists, and if they're not using a really up-to-date new machine, they might have a lot of difficulty seeing an ovary, because even in a younger person, their ovaries are only like 2 to 3 centimeters. So it may be hard to see those little follicles that kind of define a polycystic-looking ovary. So you might actually have polycystic-looking ovaries, they just couldn't see it. So if your endocrinologist has said that slightly elevated cortisol is not caused by anything else concerning, and if you're seeing an endocrinologist, this is like bread and butter for them, it's quite possible that you really do have PCOS, right?
Yep. Yeah. the treatment, whether it's actually PCOS or it's insulin resistance or things, may be similar, right? It may be kind of not matter, although it matters.
Well,
because
I mean,
you
it's a
should
combination of like
Yeah.
things that like keep yourself healthy. So trying to work on a program to lose weight to a healthy level. Again, it doesn't have to be crash dieting, but like eating whole grains, you know, like more fruits and vegetables, like healthy lean animal protein in smaller amounts. Maybe using metformin or other things if needed, along with more exercise or movement. As that kind of takes effect, if you're able to kind of, if you're healthy enough to sort of embrace that sort of program, and as a person loses weight, what some people find is even that kind of slight weight loss reduction can help with how they feel and some of their hormones on testing as well.
Love that.
Yeah.
It is very confusing, and so it makes sense that two doctors might have slightly different opinions on the diagnosis. Okay, we have time for one more.
Okay.
I'm not going to read through it, but the basic question is this woman or person is saying they see a bunch of studies recommending supplements to add to your diet for PCOS. What do you think about that?
No. I know that there was some interest about something called inositol, which is a basic sugar for a while, but what last I read, the most recent clinical research didn't support that inositol did anything, you know, had any sort of real positive therapeutic effect on PCOS symptoms.
Yeah.
So again, if you're otherwise eating healthy, there's really no need to be taking a supplement.
Yeah.
Right?
So what doctors might recommend is birth control pills.
Yep.
Sometimes that can help manage symptoms.
Yes, Dr. Kline.
You already talked about metformin,
Yes.
which can also help with symptoms. And then it's really, unfortunately, there's no cure for PCOS, right? And so it's really about managing symptoms. Knowing, if you know you have PCOS, another thing to think about, of course, we would be remiss if we didn't say this, is it can affect your ability to get pregnant because you're not ovulating normally.
Not always, but
Not
it
always.
can.
It can, yeah. And so that is something else to just keep in mind if you know you have PCOS.
And the other kind of benefit of, by the way, if you're able to, and you need to have a discussion with your healthcare provider, if you're able to start a birth control pill or something like that, it helps regularize your cycles so they become more predictable, helps control sometimes that sort of erratic, heavy bleeding.
That might help with mental health.
And mental health as well, right? It might actually, in some cases, potentially help with hair growth in unwanted, undesirable places. Sometimes your doctor might add in spironolactone or something like that, which is a diuretic, another topic for another day.
Yep.
And it also will work to help protect you against things like uterine cancer. Because a lot of people with PCOS who are not ovulating, they have lots of estrogen circulating around, but not much progesterone on a regular basis. So that pill or progesterone IUD actually helps protect you against that.
Love that.
Until you're ready to start trying.
I love that people are talking about this online.
I'm so glad that people are talking about this, right? Because it's nothing to be embarrassed about. Right. There are resources like our PCA teams, like our reproductive endocrinologists.
Yep.
And a lot of like really smart gynecologists and women's health nurse practitioners are out there to try to support.
Agreed. So as you can tell, PCOS brings up lots of questions. Luckily, we have all the answers now. About symptoms, treatment, day-to-day challenges, just like how it affects your life. If you think you have PCOS, if you have any of sort of the symptoms that these folks are talking about or any of the things that we've talked about, getting care that's specific to you is really important.
Yep.
So you mentioned reproductive endocrinologists. Sometimes if you're not trying to get pregnant, they won't see you, but sometimes
Some actually
they will.
do. Like I loved seeing patients that came in with questions about that, right?
Yep. And some GYNs who specialize in PCOS are also good resources. If you're looking for support beyond just sort of general guidance, consider reaching out to an REI, a reproductive endocrinologist. And having that care team can really help make all the difference.
Really important.
Yeah.
Oh, and also a reliable resource. If you go to the American Society for Reproductive Medicine, they have reproductive fact sheets that are actually written 1 to 2 pagers for patients, for the lay population, and I believe there's one on polycystic ovarian syndrome. So that's where you should be going to get your reliable information and not like schmick schmuck.
As always, I love talking with you.
I love spending time with you.
Same. Thank you
and
so
Dan
much.
And Lou, they're off camera.
Yes.
Lou, good curation of these questions.
I love these. As always, if you have questions that you want us to talk about, drop them in the chat. We love talking with you and for you. And thank you to these people who, without knowing, we'd peel their questions. Thank you for the people who shared their experience. I think it makes a big difference.
Really, really helpful, I think, to the population at large.
Yes. And September is PCOS Awareness Month, so become aware, educate yourself, and we'll see you soon. Bye.
Bye.